Hi, it's Dr. Bob Graykowski, your peak performance doctor and creator of the Better Brain Blueprint. Today we're talking about ways to either prevent or delay or stave off the effects of Alzheimer's disease. The most recent statistics show that over the next 50 years, Alzheimer's disease, if something is not done, will quadruple. That means that 4 times the amount of people that have Alzheimer's will actually be under the medical realm of Medicare and under the realm of debilitating processes of life. So we must start now. Things that we do now will affect us 20 and 30 years down the road. We've got to have a life vision plan to make sure that what we're doing on a regular basis with our lifestyle is actually setting us up for more golden years. So let's talk about just 5 things today. These are pretty simple. Today we're talking about eating. So we're going to talk about the alphabet, A, B, C, D, and E. So Alzheimer's disease, the number one thing that they find is that the brain has a thing called oxidative stress. So if you think about, a car and the paint job, have you ever seen a car that gets oxidized? It gets all that white plaquey stuff all over it, and you got to scrub it really hard to try and get it off, but it's because it's been exposed to the elements. It's been exposed to things that actually cause a chemical response in the paint. Same thing can happen within our body. We can be under oxidative stress by these things called free radicals. Free radicals are found in foods that are fried. They're found in most processed foods, things that have different trans fats, high fructose corn syrup. They create inflammation in the brain. Inflammation in the brain causes this process for your brain to try and protect it. So things that gets oxidized. So you want to do 5 different things to reduce the oxidative stress. Vitamin A and vitamin E are very good vitamins for reducing oxidative stress. They are antioxidants. Vitamin B, especially vitamin B6, has been shown to stave off the effects of increased protein that's found in the brain. There's a pathway that is affecting memory, and these beta amyloid proteins, these certain types of proteins get lodged in there and affects the conductivity of your memory. So high levels of an amino acid called homocysteine, which is a blood test that can actually be done. If you have high homocysteine levels, it's creating more inflammation in the brain. So we want to do things to reduce that. Vitamin B6 is a vitamin that actually is shown to reduce that process. So vitamin A, vitamin B, vitamin C is another antioxidant, which is very important for keeping our brain healthier. Vitamin D, vitamin D3, getting out in the sun, supplementing vitamin D has been shown to not only help your heart, but the nervous system and the brain. So A, B, C, D, and E. The challenge is most physicians want to just throw a medication at you. If you've got some channel blocking drugs for the heart, if you've got diuretics that you're taking on a regular basis, these have been shown to increase the chance of Alzheimer's disease. So it's important to make sure that you're eating a healthy, nutritious diet. So obviously your dark greens, your berries, all those things are very important. If you are taking medication, you should always check with your doctor before you change anything dietarily or nutritionally. But why not start now to reduce the chance of having to take medications and actually have this horrific problem that develops later on where you lose your dignity, you lose your health, and it affects you and your family. So you have to start now with looking at preventative ways for Alzheimer's. Today we're just talking about some simple basic things in nutrition. You got to start with simple steps. We will get more into certain movements and certain exercises for brain health, but start today with A, B, C, D, and E. All your vitamins are necessary in your foods or through supplementation. This is another Better Brain tip from Dr. Bob. Have an awesome day.